Earlier in the show, we talked with Dr. Dave about peripheral artery disease and how it can be misdiagnosed. This time, we're talking about the importance of second opinions. Mark Hostler is one of those patients who went for a second opinion when he developed a staph infection from a surgery he had received. Mark joins us now. Thanks for being with us.
You're welcome.
So you were diagnosed with PAD. What kind of symptoms were you having?
I had trouble walking. My legs would, they were like I would get knots in my calves, that sort of thing, where, you know, I was not very mobile.
And when did it start and how long did that last?
Well, it would depend on how active I was, and it would pretty much debilitate me, and I'd have to stop and rest, and then I could start again, but it would do the same thing.
And I guess how long did that go on before you did something about it?
I've had probably over a dozen procedures in my legs. My left leg has an artery from my right leg, so I have a bypass in my left leg, and the right leg is the one that I was told a little over a year ago that there's nothing more they could do for me and that I had to lose my leg.
Wow.
And that's when I was told by my home nurse and my podiatrist to get a second opinion, which my podiatrist put me in the direction of Dr. Dave. And he is a cardiologist also, and he was taking over the practice of my previous cardiologist who retired. So not only is he a cardiologist, he's a vascular surgeon. So cardiovascular experts.
So you went to see him. So
I did.
What did he say?
He said that we're going to do everything we can to save your leg.
Wow. How did that make you feel?
Well, I finally had some hope, and, you know, it came to fruition. I mean, here I am. And I have no assistance to stand here. I walked up here myself. So.
And so what did he do?
He performed procedures on my leg. Of course, you know, I like to watch, but they put you to sleep. And it's a true story. 7 days from the time he did the procedure on my leg, I set my crutches down, and they're probably still at the same place.
Wow.
And this is a true story.
How does that make you feel?
I mean, 68 years old. I mean, I wouldn't be, you know, as happy as I am now if I couldn't walk. I mean, they were talking about, you know, putting a fake leg on and all that. So
Wow.
I still have my real leg.
So what has life been like now?
Well, pretty good. I mean, I'm able to do the things that I did before, you know. Of course, you know, as the older you get, the least you can do, you know, you can't do as much, but I get along, I get around.
Well, good for you. Mark, thank
you
you so much for sharing your story with us.
You're welcome.
Thank you to Deborah for that interview. Also, thanks to cardiovascular experts for sponsoring that segment. We'll be right back.